So I'm going to talk to you now a little bit about diet and living well with NETs. I'm not sure if any one of you are familiar with this. I think anyone who's been a parent, certainly from my perspective, I could probably recite this in my sleep because it was one of my kids' favourite books, and we're going on a bear hunt, and you might remember you can't go over it, you can't go under it, you can't go around it, you've got to go through it. And living with NETs is a bit sometimes like a bear hunt. It's actually not that much fun. They say, oh, what a beautiful day, but actually sometimes it doesn't feel like such a beautiful day and you are going through it. So I wanted to talk about some tips and strategies for getting through it. So I guess we already know this. The common issues for people with neuroendocrine tumours include things like delayed diagnosis, and we haven't actually really touched on that this evening. But many people who are diagnosed with a neuroendocrine tumour have gone through a number of preceding diagnoses and often seen many health professionals over several years before they receive their diagnosis. But there's also a great amount of disparity between people in the city and people in the country, people who manage to be lucky enough to be referred to a doctor who knows about neuroendocrine tumours and those who might really struggle navigating that system. The symptom burden, and we've heard a lot about that from Gabby and from Tim, and the fact that these are symptoms that are often for years and years and years. And the psychosocial impact, so living with an uncertain future but not knowing how long that piece of string is, and really the anxiety and the worries when scans are approaching, and that gap between the scan and getting the result, and then dealing with the information from the result, absorbing all of the new information, and that incredibly hugely complicated language that we all need to learn when we learn about neuroendocrine tumours. The other thing that we've already talked about as well is the number of symptoms. So we know that people with NETs, up to 30% of people have diarrhea, similar amount have bloating and abdominal discomfort, flushing, gas, and these are such socially acceptable things to talk about. If your neighbour's going, oh, how are you feeling? Oh, I can't stop farting. Like, it's not really the sorts of things that you maybe would be able to ask family and friends for support for, or maybe you do, but these are difficult things to be living with for people. So I'm going to talk to you a little bit about nutrition and NETs, and just wanted to acknowledge the input of our dietitian in Melbourne at Peter Mac, Erin Lang, who helped put these slides together. We weren't able to find a NET-specific dietitian to come and speak tonight, so Erin and I have worked together to put these slides together. And Erin's actually on maternity leave at the moment, but she's coming back next month, and she does do Skype consultations. So if there are particular dietary issues that you might have that you need further input into, then we can facilitate a connection with Erin as well. So I'm going to talk about some of the things that you might experience that can be related to diet and to symptoms. So carcinoid syndrome, and we've already heard that this is when there's large amounts of hormones being released into the bloodstream, and there's the cluster of symptoms such as flushing and diarrhea. Something that Tim referred to very briefly is the pellagra, and pellagra is the rash that's actually caused by vitamin B3 deficiency, and I'm going to talk a bit more about vitamin B3 deficiency shortly. It's actually something that there's been some more recent research about that has made us aware that a significant number of people with NETs are affected by, and there's some specific advice around that now. Certainly surgery, and that's probably a little bit more of a no-brainer for most people. If they've had surgery, especially to their gut area, they would expect some changes in their digestion. So the small intestine is the main site for where your nutrients are absorbed. The pancreas produces enzymes that helps our body digest and absorb fats and vitamins, and the large intestine is where we absorb water. So removal of parts of the intestine, depending on which bit's been taken out, can result in things like diarrhea and nutrient malabsorption. Medications also affect our digestion, and particularly medications that we use in neuroendocrine tumours. So both Tim and Gabby also spoke about the somatostatin analogues, so the octreotide or the lanreotide, or I think the common term in our Facebook support group is butt harpoon, or horse tranquilizer injections I've heard as well. but they block the release of hormones that are produced by the tumour. So we want them to block the release of the hormones produced by the tumours. But unfortunately, these drugs aren't clever enough to think that's a tumour-related receptor. I'll block that one and leave the normal ones in our body. So sometimes they can actually block up the normal hormone-producing cells that help us break our food down and absorb the nutrients. And so that can result in malnutrition and fat malabsorption particularly. So I'll talk a bit more about what we can do about that shortly. But also some of those further down the line targeted therapies, so everolimus, sunitinib, can cause some damage to the lining of the intestine and cause diarrhea and abdominal discomfort as well. So I wanted to talk about managing fat malabsorption because this is something, certainly anecdotally on the phone, talking to people on these monthly injections, sometimes they really just take it for granted that the side effects and the symptoms they're getting from these medications, they just have to put up with. And sometimes there's actually things that we can do about it. So fat malabsorption means that the fat that you're eating in your diet, the really important fat that you're eating in your diet, is actually passing through the gut without being broken down and absorbed. And that means that, I'm glad we've all finished eating, but it results in really horrible bowel motions. So they're generally pale, they can be really floaty or frothy, they make a mess in the loo, they put an oily film over the water in your toilet, they're hard to clean, the toilet afterwards, they stink, and you fart to bilio. So, and it's really uncomfortable, it's very undignified, and sometimes if you've got really oily poo, it can actually cause some leakage too, so incontinence can be an issue with this. So again, a lot of people might find that they get that sort of thing happening for a couple of days after their injection and then it settles down, in which case we probably say go easy on the fats for that couple of days. But if you're finding that throughout the month you're getting those sorts of horrible symptoms, we can trial what we call pancreatic enzyme replacement therapy, and the common name for that is Creon. So that's a doctor's prescription, but a lot of doctors haven't heard of this, or they might have heard of it when they're treating kids with cystic fibrosis or other conditions. They might not really link this with neuroendocrine tumours. So there's some information on our vitamins and minerals fact sheet about things like dosage of Creon. So if you've got that issue and you're going to see your GP or your oncologist, it's actually, and you're not sure if they will know about dosage of those things, you can actually take the printout along and that can be helpful too. Really importantly, it's important to keep eating fats as they provide your body with the essential calories and vitamins. So Creon tablets, the other thing that's really important for you to know is you take them with the first mouthful of food. It's no good taking it half an hour after you've eaten your food because the fat's already passing through and not being absorbed. You need to take it with the first mouthful. If you've got diarrhea, the other thing is just to really remember that if you're losing lots of fluid, you're losing lots of electrolytes. So sometimes taking things like Hydrolyte or the sports hydration solutions can be quite helpful just in helping to feel a little bit more well and not getting dehydrated. So a lot of people ask me, what can I eat to make my tumours go away? Or what can I eat that's going to help my cancer? And we know that actually there's no evidence to say that changing your diet in a dramatic way will change the course of a cancer, and actually cutting big food groups out can actually cause malnutrition. So we really advise that if you're thinking about changing your diet that you do talk to a dietitian. As we said, food restrictions can lead to weight loss, muscle loss, malnutrition and deficiencies. There are some dietary triggers that some people can experience, and I'll talk about that in a second. But I just did want to say that for people who are having trouble with their gut, then sometimes eating multiple small meals a day, for example, 6 small meals a day, and those other tips up there, so eating and chewing slowly, can be helpful. The other thing is that there's no law against convenience foods. There's actually some really healthy options out there that are very easy in the freezer section or the fridge section of the supermarket. If you're tired, it's probably going to be better to grab one of those than to grab takeaway or fast food, and that's absolutely fine. The other thing is that I know a lot of people do have people around them who say, oh, if there's anything I can do. And it's hard sometimes to think of the thing to tell them to do, but if they wanted to, freeze some meals, some single portions of meals for you to have in your freezer for those nights where you're thinking, oh, I just can't face the kitchen, I just can't think about creating a meal, then that's a good option for people as well. There's actually a very good website called Gather My Crew, which enables people to sign up to a roster so that they can say, oh yeah, Thursday in 2 weeks' time, I'll cook you a spaghetti bolognese. Or other practical things like, oh yeah, I can drive you to your appointment, or pick up the kids early from school, or those other things. So Gather My Crew. I haven't got it up there because we're talking about diet, but I just thought I'd mention it because it came into my head and I thought it might be helpful. Limited evidence about dietary changes, but if you do suspect a dietary trigger, it's worthwhile starting a food and symptom diary and asking for a referral to a dietitian. So that's just a picture of the start of that food and symptom diary, and basically what it is writing down the food that you've eaten, and then it's tracking symptoms over time, and that's really like the homework that you would do after seeing the dietitian for the first time. So if you actually come to your first dietitian's appointment armed with a filled in food and symptom diary, you're actually going to give them a whole heap more information that they can work with on that first consultation. And they'll be looking at things like, certainly if there's symptoms that might be related to food you've had that day, but also sometimes that's a couple of days earlier. But also they can look at your overall intake and think, oh gosh, how are you going with all of your micronutrients, and do we need to think about supplements? Wanted to talk a little bit about trigger foods, but also some of the things that can also create gut and digestive issues. So certainly bigger meals, as I said earlier, eating smaller and more frequent meals can be good. Also try and just slow your eating down if you can. Try and avoid the fizzy drinks. And I really love a fizzy drink, but that can increase the amount of gas in your gut. Be mindful about fat. So again, if you're on the monthly injections and you're finding you're getting that really horrible tummy for a couple of days, go easy on the fats for those couple of days. But again, if you're getting those symptoms all through the month, we need to maybe start thinking about a supplement to help you break down and absorb those fats because of the important vitamins and minerals that are in them. Go easy on the spice. Sometimes instead of a spice, you can, like stock powder can be really a really nice way of supplementing the flavour to a food that then doesn't necessarily inflame the gut so much. And go easy on the alcohol as well. And then there's just some things that people can find to be triggers. So certainly fibre. So fibre is really important, but insoluble fibres such as bran, whole grains, vegetable fruits, skins and seeds. So if you've got a lot of diarrhoea, then they can make that a bit worse. So there's also some wind-producing foods that people can find problematic, so things like lentils, nuts, cabbage, and garlic. And then some people find that amines, foods with amines, can be problematic for them. If these foods don't cause you problems, there's no need to avoid them. So sometimes people ring me after, 2 years of living with NETs and say, oh, well, it's such a pain because I've really liked, my cheddar cheeses. And I'm like, well, why are you not eating your cheddar cheese? And, oh, because it's got amines in it and I need to not eat that. Well, they don't make tumours grow any more quickly. For some people, they give them more symptoms. And if that's the case, then certainly avoid them. But if they don't make you feel unwell, it's fine to eat them. And if you enjoy eating them, that's really important. We're living with this for a very long time. I'd hate for someone to not be eating the food that they really loved because they thought that was going to make their tumour behave in a better way, and actually it won't. So it's only if it's a trigger for you. So I've talked about fat malabsorption. I'm not going to talk about that any longer. I'm going to talk about vitamin and minerals, so particularly vitamin B3. And so Erin Lang, the dietitian from Peter Mac in Melbourne, is doing her PhD on this particular subject, and she's done all sorts of really comprehensive testing, including blood and urine tests of people with neuroendocrine tumours. And what she's found is that the rate of vitamin B3 deficiency is far more common than we imagined. And it's actually very likely, if you've got carcinoid syndrome, you're likely to have a vitamin B3 deficiency. And the reason for that is that the building block that the body uses to synthesize serotonin, which is the thing that causes the carcinoid syndrome, that's also the building block your body uses to create vitamin B3 stores. So if you're using a lot of serotonin in your body in those tumours producing to create carcinoid syndrome, you're also likely to be deficient in vitamin B3. And there's a suggested dosage there of vitamin B3 for people who have active carcinoid syndrome. The other thing just to mention is that surgical removal of parts of your stomach or your small intestine can also impact on vitamin and mineral absorption. So if you've had those sorts of surgeries, it's worthwhile talking to a dietitian. Often people who've had large amounts of their gut removed are vitamin B12 deficient and need to have vitamin B12 injections. So it's important to look after this. And it's, this is a long haul. People are living with this for a long time. Sometimes you might forget. But these things are important because the deficiencies in these vitamins can make you very, very ill. So I'm going to keep going. And just mention that we've got our booklet out the back, the Nutrition and NETs booklet. If we run out, then we can always send you another copy of that. And the other thing that's available on our website is the vitamins and minerals and NETs fact sheet. And I would really recommend you download and print that one for your own reference. So I'm going to keep going and talk about diarrhea management, because I know that we all want to hear from our panel. But this is important. It's a bit of an area of passion of mine, which my teenage children find extremely embarrassing because I get a bit excited. But anyway, the really important thing is that if you've got diarrhea, talk to your doctor, because there's more things than just NETs that cause diarrhea. And sometimes people ring me and say, oh, my NETs are really paying up, I've had this awful diarrhea, and we actually work out they've got food poisoning. So having NETs doesn't mean that you won't get something else that causes you to be unwell. And it's always important to go and see your GP. If it's a change in symptoms, let's work out why those symptoms are changing. It may be related to your NETs, but it may not be. Either way, we need to know what it is so we can treat the underlying cause. Certainly look at diet, and the food and symptom diary can be really helpful for that. There's some over-the-counter medications, things like gastrostop, that can be very useful. Talk to your doctor about it when you see your doctor next. If you're using a lot of over-the-counter products for controlling diarrhea, make sure you talk to your doctor, that your doctor's aware of that. The other thing is that there are some prescription medications that are a little bit outside. Some of them are outside the square, so I'm going to mention them. Codeine, we use that for pain relief, but sometimes that can be really actually quite effective if people have got this diarrhea that's not responding to all of the other things. Creon, if we think it's a fat malabsorption issue. Questrin Light actually acts on the bile salts in the gut, and that can help some sorts of diarrhea. So again, this is something to talk to your doctor about. We already talked about telotrestat, and we're really pleased that that's now on on the access scheme. So again, if you've got carcinoid syndrome diarrhea and you're already on these monthly injections, talk to your doctor about perhaps giving that a go. The other drug that we don't often use directly to fix diarrhea, but we use it and it makes people constipated, is ondansetron. So this is an anti-nausea drug that we often give people when they're having chemotherapy. And when I'm giving chemotherapy to people who don't have NETs, I get them to take Caloxyl, Senna, or lactulose and things, because we know they're going to get constipated. So ondansetron, because it's got this side effect of causing constipation, sometimes that can be quite helpful in drying up some diarrhea. There's also some anecdotal things, and I really want to be very clear that these are not evidence-based. So this is anecdotal only. You need to talk to your pharmacist and your doctor about trying these sorts of things. But white marshmallows, that's pretty harmless, and a lot of people swear by them. So if you're getting a lot of diarrhea, apparently the pink ones don't work. Who knew? But the white ones, go for it. Another thing that some people find extremely useful is slippery elm powder, and just the really important thing about that is that if you're going to try that, you separate it from your medications by at least 2 hours, because it creates this slippery coating on the inside of the gut. And we don't have any evidence about this, but there is a concern that perhaps that might impact on the absorption of medication. So that's that. Probiotics. Now the jury is really out on probiotics, and there's a lot of research being done in this area. We don't have good evidence at all. Some of my patients swear by them and say that if they stop taking their probiotics, their symptoms get worse. Who knows what that's about? We will find out. We'll know more. In 5 years' time, when we're looking back on this conversation, I'll think, oh my goodness, if only I knew. There's lots of research being done, but it's worth thinking about, talking to your doctor again. Don't take probiotics if you're on chemotherapy, is the advice I hear from doctors. The other two things are very anecdotal, but I thought I'd mention them because sometimes people find them helpful, is a powder called glutamine, and also nutmeg powder. Don't take too much nutmeg because apparently it can make you high. But again, nutmeg powder for some people can be helpful. Talk to your doctor or your pharmacist. And some practical tips, because diarrhea makes you feel revolting, and there's some, local skin things that can be really horrible to deal with. So when the bowel contents are rushing through really quickly, they don't have the chance to correct their acid-alkaline balance properly. So we find that what's in the small intestine is very, very alkaline, and if it hasn't had a chance to sort of move through the large bowel nice and slowly, as it should, what's coming out the end is actually very alkaline, and often it feels acidic, like it feels really burny, but it's actually an alkaline burn. So if you have time before you need to sit down, putting some barrier cream on, so you can get that, barrier cream from the supermarket, or Vaseline, or if you can get some of that on a piece of toilet paper and on your bottom before you go, that will create a bit of a skin raincoat. Also things like using, like the Chucks wipes, you can get very cheap versions from $2 shops and cut them up. Don't flush them, or the plumbers will have my guts for garters. But they can be much more gentle than toilet paper, so moistened wipes. With commercial wipes, you can try those, but stay away from the ones that are perfumed or that have alcohol. And they can get really expensive. If you're getting diarrhea all the time, they can get very expensive. The other thing that's really handy is that VIP spray. I don't know if anyone's seen that in the supermarket. It's a tiny little bottle. You put one squirt into the toilet bowl, and it's quite magic in terms of getting rid of smell. A lot of people actually find carrying some spare underwear in the car or in their handbag is just a handy thing, just to give you the confidence to get through the day. And importantly, the Continence Association can be really helpful in providing some more practical tips. If you're having issues with ongoing continence, there's actually some funding available to help with products that you might need to use. So call the Continence Association, the number's on the screen there. The other thing I just mentioned is our wallet card, which is at the back of the room. The idea of this is that it says that you've got a medical condition, need to use the toilet facilities urgently. I challenge any cafe owner or shop owner not to let you use their toilet. If you're standing there looking like this, no one wants to deal with that mess. So that's the diarrhea fact sheet that we've also got up the back of the room and on the website. And yeah, my kids are just horrified that I find this so exciting. General tips for getting through it, one day at a time. It's very overwhelming sometimes to be looking a long way ahead, especially when there's all of these scans. So as much as you can, one day at a time. Choose your support team. This is like a marathon. And so when you go and run a marathon, you're not doing it on your own. You've got your person at the 5K with your special drinks. You've got the person at the 10K with your protein balls. You've got your support crew along the way. So that's really important. Ask for and accept help. And this is really hard. Often we get NETs when we've been living a life where we've been caring for other people and doing lots of very productive things and being the person who gets stuff done. And it's really weird to be the person who has to ask for and receive help. But it's really important. So from family and friends, from health professionals, and also from the financial and the practical side, and the Cancer Council is brilliant in that regard. Navigating the system is a real learning curve. So I would encourage you to learn as much about your condition as you can. Find a doctor you can trust, and if that's not the doctor you're seeing, perhaps see another one. Include your GP. The doctors are getting better and better. The multidisciplinary teams are getting much better at communicating with GPs, but GPs are often on a real learning curve with this stuff too. On our back table, we've got the health professionals booklet, so that's actually a really helpful thing to take to your GP to show them. I'm moving on. If you have a disagreement with your doctor, and this is not uncommon, this is a long-term relationship and it's a bit like a marriage, so sometimes, everyone gets on everyone's nerves, and we just would encourage you, if you've got a difference of opinion, present your point of view politely but assertively. If you need to, we would encourage you to bring a support person to appointments, so two sets of ears are better than one. Asking for copies of your scans and reports. And ask your doctor if you're actually able to record your consultation. So every smartphone has a voice recorder, and sometimes that can be really good just to listen back to, because I know for me there's heaps of bits of conversation that I forget. If you've got questions for your doctor, check whether your doctor's happy for you to email them ahead of time to just give them a heads up that this is the question that you'd like to talk about. You could ask them for a written summary, and sometimes that can be really helpful. And just to be really honest, so raise important issues for you. raise if you've got side effects or symptoms. If anything changes, you need to tell the doctor. Even if this has been going on for a long time, they need to know if you're still getting diarrhea or other symptoms. And if you're seeing more than one healthcare practitioner or using other therapies, so a lot of people see a naturopath or all sorts of other practitioners, make sure your medical doctor knows about who else is in the mix. So I'm not going to talk too much more, but just wanted to say we're going on a bear hunt. It's not I'm going on a bear hunt. I'm not doing this by myself, and it's really important that you know that none of us need to do this on our own, and the support is definitely there. So I'm not going to talk too much about Unicorn Foundation because I know you've got questions for our panel, but it's really important for you to know that you can get in touch with us, and I've got our contact details at the end.